Hello and welcome to the HOSA podcast. I'm Lilia.
And I'm Cristina, and today we'll be talking about cancer prevention.
Now, what exactly is cancer? Cancer is a disease that arises when abnormal cells divide uncontrollably in the body, which forms tumors. These cells may spread throughout the body, which can be especially harmful if the cancer reaches essential organs. Organ failure may occur if the cells reach these organs, which shows how complicated and tragic this disease can be. The spread of these cancer cells to other areas in the body is known as metastasis.
One of the most common types of cancer is breast cancer. In breast cancer, breast cells mutate and become cancerous cells that multiply and form tumors. This typically affects women and people assigned female at birth, around the age of 50 and older, but it can also affect men and people assigned male at birth, as well as younger women.
Another common type of cancer is melanoma, which is also known as skin cancer. This is an extremely serious and very common form of cancer, in which the cells that produce melanin, or the pigment in our skin, become cancerous. This can cause unusual growths on the skin that often look darker than usual.
Another common type of cancer, lung cancer, is the leading cause of cancer deaths in the world. Two major types of lung cancer are non-small cell lung cancer and small cell lung cancer. Causes of lung cancer include smoking, secondhand smoke, exposure to certain toxins, and a family history.
Cancer prevention is obviously the best thing to do when approaching this disease, but when a diagnosis has been made, it's irreversible. So how can we treat cancer? There are a few different treatments to cancer that are commonly performed, one of which is surgery. In surgery for cancer, typically when there are benign growths or even just easily accessible growths, a surgeon is able to remove them from the body. Another treatment is chemotherapy, in which drugs are used to kill fast-growing cells through the use of drugs. However, there are many side effects with this treatment, since not only does it target cancer cells, but also healthy, fast-growing cells in the body, like hair cells, cells in the stomach lining, and skin cells, epithelial cells. And so this is why typically people are so hesitant to approach chemotherapy when they're diagnosed with cancer. Another form of cancer treatment is radiation therapy, in which DNA in cancer cells is damaged to prevent uncontrollable replication of these cells.
So how can we prevent cancer? To prevent cancer, one of the best things you can do is to wear sunblock whenever you go outside. The sun emits very harmful UV rays, and the radiation can cause damage to your DNA, increasing your risk for mutations that lead to cancer.
Another way to prevent cancer risk is to not smoke. Using any form of tobacco or smoking or vaping or any form of drug use such as this can really enhance your risk for many types of cancer, especially lung cancer. But also being around secondhand smoke, such as in your household if someone else smokes, can also contribute to your risk of developing cancer. And it's very important to make homes smoke-free, especially when young children who are at higher risk of developing these cancers due to smoke exposure are present in a household.
It's also very important to do your part in reducing indoor and outdoor air pollution. Air pollution includes smoke and other contaminants and many chemicals that can introduce toxins to your body and increase your risk for cancer. These toxins can affect your DNA and how healthy your cells are.
Another way to prevent cancer is simply through your lifestyle. If you tend to eat a lot of junk food, a lot of processed food, you play a lot of video games, and you're not very physically active, you're at a much higher risk for developing cancer due to the health of your body. So it's really important to consume a healthy diet, including fruits and vegetables, which are full of vitamins and nutrients, and to also be physically active. This can just be an hour a day, walking with a friend, while being on the phone while walking with a friend, going biking, going hiking, instead of playing video games. Just doing these activities can help reduce your risk for cancer.
Limiting your alcohol intake will also help reduce your risk for cancer, as alcohol can damage many of your cells. For example, with overconsumption of alcohol, you can develop cirrhosis, a liver disease where your cells in your liver are damaged and can die. So by limiting your alcohol intake, you're reducing the amount of damage that is being done in your body and keeping it healthy.
Finally, to prevent cancer, you need to be aware of what's going on in your body. This means when you go to the doctor for your yearly checkups, you should be taking part in organized cancer screening programs. So when you go to the doctor, when you're having your checkup, you should request to have a cancer screening. So this way, the doctor can conduct certain tests, and through these tests, the doctor can detect any cancer cell growth. The earlier you detect your cancer, the higher your chances of being cured or avoiding a very extreme form of this disease. Cancer takes millions of lives every year, and it's really important to do what you can to prevent your chance of being diagnosed with cancer. Thank you for joining us this month of February for Cancer Prevention Month, and we hope that you learned something today.